Thank you all for coming tonight. We've got folks both in person. Thank you for coming out on this beautiful day in Oregon. We've got folks from all across the country joining us on Zoom as well. So saw some folks from New Orleans and Connecticut and folks from around here in Oregon. So welcome to FURst Aid, Preventing and Treating Colic in Horses, presented by the Oregon State University Carlson College of Veterinary Medicine. My name is Jens Odegaard. I'm the Director of Marketing for the college. And here at the college, our mission is to advance the health of people, animals, and the environment through inclusive and equitable education, research, and services to the public. We have 346 students, 312 are studying for their doctorates of veterinary medicine, and 34 graduate students in our comparative health sciences program. The college serves the public with research and direct clinical and diagnostic services through our Lois Bates Atchison Veterinary Teaching Hospital and the Oregon Veterinary Diagnostic Laboratory. A few housekeeping notes for today's presentation. For those of you online, at the bottom of your screen, please use the Q&A feature for your questions. Feel free to submit them as we go through the talk, and at the end of the presentation, we'll get to as many as we can. For folks here in the room, please hold your questions till the end, to the Q&A time. A quick note for questions, we will not be able to answer questions specific to your exact animal. We can answer general questions about colic. So happy to answer those. I'd now like to turn it over to today's presenter, Dr. Kelsey Jurek. Dr. Jurek is an assistant professor of large animal emergency here at the college.
Thank you. Hi, everyone. Get this situated here. So thank you all for coming and for being with us online. I'm pretty excited to present this topic to you guys. As an emergency surgeon, this is one of the things that I do the most frequently. And so it's kind of one of my interests, if you would, from a clinical standpoint. And so hopefully the information presented here gives you a little bit better picture of what colic is and what we're doing or we're looking for when we're evaluating things, and also to kind of go through prognoses and really when you should be getting your veterinary involved, and what it looks like if things aren't kind of going our way, and so on and so forth. So just to start, I just want to make sure that I've kind of also given you guys a couple of housekeeping things. I don't have any conflicts of interest. If I happen to mention a brand name or something like that, I don't have any financial interest in such things. Just commonality, use of terminology is all. Any personal photos or videos in this presentation are shared with permission. And then I do have surgical photos included in this presentation. And so just please be advised, if you're not a fan of those types of things, I'll kind of try and forewarn, but there will be some scattered throughout the presentation. So just to let you know a little bit more about who's talking to you here. This is the kind of my general timeline of how I got here to Oregon State University. So I graduated with my doctorate of vet med from Minnesota, which is where the accent comes from. If you're wondering, not from here. In 2017, I graduated. I did 2 internships. Was in private practice for a year, and then I was at Tufts University, Cummings School of Vet Med out in Massachusetts. I did my large animal surgery residency at Oklahoma State College of Vet Med, and that was from 19 to 22. And then while I was there, I also got my master's degree in veterinary biomedical sciences. I was an instructor there for a year for large animal emergency, and then became boarded with the American College of Veterinary Surgeons in early 2023, and then moved out here in May to start a long-term position as the large animal emergency surgeon here at Oregon State University. So just a brief overview of the presentation itself. So we'll kind of go through what colic is, how we respond in involving your veterinarian, referral to a veterinary hospital and what that looks like, and then differentiating, or how your veterinarian is going to differentiate between surgical and medical colics. Go through kind of current cost of care, in particular to referral and some of the more kind of serious colics, and kind of go through those costs, and then talk through prognosis and some tools for prevention that we at least know that we can try and help decrease the incidence of colic that we see in our horses. So just kind of a quick question, and the room can do kind of a show of hands, but how many people have dealt with colic in your horses before? Yeah, so wholeheartedly expected to see most people's hands stand up or be raised there. And then another question, hopefully the hands are much less this time, but has anybody lost a horse to colic? Yeah, so still gonna be a few. And so the reason I kind of bring these things up or ask these things right away is, one, to point out how common this issue is in our equine patients, but also to you know, kind of highlight the fact that colic can be anything from, you know, way over here, super mild, they kind of have a heart stuck sideways and they're all better as soon as they pass it, all the way up to, you know, something that we can't fix regardless of anything that we try to do surgically or not. So this is a very broad category of diseases, lots of underlying causes. There it goes. And so then kind of another follow-up question, which of the following are potential causes of colic signs in the horse? You can kind of think to yourself or think through what the options are. Maybe all heard of this twisted gut, kind of the layman's term, twisted gut or an impaction, scrotal hernia in stallions, chronic kidney disease. And again, I pose this question simply to point out that any of these things can cause signs of colic. So there is not one underlying cause, and we'll kind of go through those things now. So what is colic? Colic is a general term for abdominal pain. So that includes anything within the abdomen. The GI tract is the most commonly blamed for signs of colic, but we have to remember, horses also have other abdominal organs. So the urogenital tract can cause colic signs, the liver can cause colic signs, the kidneys can cause colic signs, the spleen can cause colic signs, anything within the abdomen, the horse responds in similar manners, whether it's the GI tract or one of these other things. The other thing to point out is that thoracic disease can also mimic signs of colic. So a horse that has pleural pneumonia or fluid in their chest, really severe pneumonia signs, will often present as colic horses because they go off feed, they get a little bit funny, they start stretching out or looking painful, grimacing, those sorts of things. And also cardiac abnormalities. A horse that's got an arrhythmia or cardiac failure can also present as colic because, again, the signs could be pretty similar to what we see in mild colic. So just know it's a very generalized term. It does not mean one specific thing. So many of you probably already know, but just kind of going through the list of potential colic signs, your horse can go off feed, they can be flank watching or looking at their side, kicking at their belly, getting up and down really frequently. Rolling is one that lots of people associate with colic signs. Prolonged recumbency, so laying down more often than is normal for the horse or for longer periods of time. Just this sense of not being right, some people will certainly pick up on. Facial grimaces, any changes in attitude, minimal to no manure production can be kind of a very early sign of some sort of dysfunction. Straining, bloating, or abdominal distension, where you look at the horse and you go, oh, that horse looks bigger around than I think he normally does. So if you notice any of those signs in your horse, what are you going to do? Very initially, what should I do? So one of the things that I really am a proponent for horse owners knowing, just again, because these things are so common, is how do you take a physical exam in your horse? How do you do a physical exam? We're going to go through that. Initially, typically tell people take away access to food until we can figure out what's going on. Hand walking certainly can be helpful, and a lot of people know you walk your horse to prevent it from rolling, okay? In general, I'll just let you know, there is no correlation between a horse rolling and an increased incidence of them twisting their gut, okay? But what rolling can do is aggravate the signs that they're already feeling, increase their cortisol levels, their stress levels. It also does make them prone to self-injury, where they roll into a wall and cast themselves, and it can kind of compound the issue from there. And certainly some walking can be helpful in regards to if they're doing some cramping and things like that. It certainly can be helpful from a treatment standpoint as well. I typically do also tell people separate them from their herd mates. If you've got a different pen, that you can make sure that the pen is clean. And really the benefit of doing this is A, the herd mates aren't interfering with what's going on, but B, you can also tell for sure, is that horse producing manure or no? So if there's any question, having a separate area as kind of a medical pen is really good, because you can actually answer the question, is this horse passing manure? Is it normal or not? And if they're all together, that's very hard to answer. And then regardless of how severe it is, never be afraid to contact your veterinarian. So even if you just kind of have a question, just because you call your veterinarian doesn't necessarily always mean that they have to evaluate the horse. But they're the ones that are going to know best between you and your specific animal and the situation, what would be advised, okay? So this is a really wordy slide. I kind of wanted to put it all in one spot for you guys. But in regards to doing a physical exam, this is kind of the general parameters, what we're going to be looking at if we've got a horse that's presenting that's kind of not right, okay? So the horse's temperature is taken rectally. This is a good thing to teach horses how to do when they're young horses, get them desensitized to doing this. Normal is for an adult horse, 99.5 to 101.5. As soon as we get above 101, we kind of start getting a little bit funny about it. So it should be below 101, typically speaking, okay? The heart rates on stethoscopes, you can get pretty readily online or just at a local drugstore. They don't have to be anything fancy. And you can actually listen to their heartbeat right behind their left elbow, okay? The thing to keep in mind with horses is that their hearts are much, much bigger than ours. And so you will hear 2 very distinct beats, sometimes 3 very distinct beats, and that can be normal, the 3 distinct beats, okay? But it is 2 beats. The lub dub is very big and wide. So don't count lub and dub as 2 different heartbeats, right? It's easy to do in them if you're thinking about your own heart rate. So an adult horse, anywhere from 24 to 48 beats per minute is typically pretty normal. Foals are obviously a little bit higher than that. Respiration rates, elevated respiration rates, so if they look like they're breathing very heavily, can certainly be a sign of pain. Normal is 12 to 24. Kind of watch their flank area so that, again, they're going to have an inhale where the flank goes out. They're going to have a pause, and then they're going to have an exhale where the flank comes in. That is one whole breath. So again, their phases of breathing are separate. Don't count them as 2 breaths. It's actually all one, okay? GI motility, again, with that drugstore stethoscope, you should be able to have a pretty good idea of if things are moving around in there. So listening to top left, top right, bottom right, kind of 4 different quadrants, and they should have 1 to 2 kind of good GI sounds or gurgles every minute. Keep in mind, a lot of people think, I can hear their gut sounds just standing next to them, so they've got good gut sounds. Really, really loud or very frequent or constant noises are not necessarily normal, okay? So if you're standing next to the horse and you're not trying to hear gut sounds, you're not listening for them, and you can still hear them gurgling, that's not normal either, okay? So there is too much of a good thing. Mucous membranes, if you kind of curl their upper lip back, you want to look at their gums above their upper teeth. They should be pink and moist. I've included this picture because this horse is very much not normal. If you see mucous membranes like this, absolutely we need to be doing something about it, okay? The capillary refill time, if you take your thumb and you kind of press it right above the corner of their upper incisor, you press it hard and then you let go. You're going to count the number of seconds until the blood fills back into that space. So it's going to go just like you can do it on your own thumb. If you push in and then let go, you're going to see there's kind of a blanch of color there. So you're going to do the same thing on the horse's mucous membranes. You're going to count the seconds. It should fill in pretty quickly. So about 2 seconds, 1 to 2 seconds is normal. If it takes a long time for that color to fill in, it's a sign that the horse is likely hypovolemic or dehydrated, okay? You can also do a skin tent. This is a little bit less reliable in regards to the horse's level of dehydration. We really don't know for sure how dehydrated a horse is or not until we do blood work, and we'll talk about that a little bit more. But doing a skin tent fold where you grab their neck and then pick it up in a tent and then let go and you see how fast it stacks back down. That's one way that you can kind of attempt to assess whether or not the horse is really dehydrated. Older horses always take longer, so sometimes you can pick up an older horse's skin and it can stay up pretty prolonged, and that can be normal because as they get older, they lose elasticity in their skin regardless, okay? Again, I already mentioned the abdominal contour, does the horse appear bloated? And then if you have a stallion in, again, I kind of alluded in that first question, scrotal or testicular issues can also present as colic. So stallions should always have their scrotum or their testes palpated to make sure that there's nothing markedly abnormal with them. I've included this picture. This horse, you can tell, is abnormal just from afar. And this horse actually had a testicular torsion that was causing signs of colic. So when to involve your veterinarian, it's good to involve them regardless, whether they see the horse or not. So again, having an established relationship with a veterinarian who knows you, who knows your horse, is really important in these situations because it elevates the potential kind of degree of care that you might get after hours. Some people, because of the shortage of veterinarians that is happening all over the country, there's gaps in after hour coverage, and there's, it can be difficult to have enough veterinarians in a particular area to be able to see all the emergencies out in the field. And so it certainly is much better and potentially will be able to help get that horse care if you already have an established relationship with the veterinarian in a non-emergency situation, okay? Signalment is important. So by signalment, I mean what breed is the horse, what age is the horse, and the history of the horse from that standpoint. And I'll go into that in a little bit later on here. And then when you do talk with your veterinarian, having all of this history information is going to be really important. So thinking about these things before you call is going to help kind of expedite their ability to make recommendations to you. So how long and how severe are the signs of colic that you're noticing? Were you able to do a physical exam, and what are some of the things that you found? So were you able to do a physical exam and you thought, well, that heart rate's really, really fast. That's a good thing to pass along to your veterinarian. Any recent changes in feed or turnout, routine, weather, etc. Does the horse have any medical or surgical history of any sort? It doesn't have to be colic related, but just making sure that they kind of know anything recent that's happened from that standpoint. Any recent administration of medications. So in particular, this means deworming medications, NSAIDs, which are anti-inflammatory medications. The two most common ones that you hear about are Banamine and phenylbutazone or Bute. And then antibiotics. Is the horse on antibiotics for anything? Okay. And then in this kind of colic episode that you're dealing with, have you given the horse any treatments, and what's the horse's response? Did it help at all? Did it not help? Is the horse getting worse, better? Staying the same? And then also good to note, particularly if the veterinarian maybe doesn't know some of these things, are any sort of notable behaviors or stereotypies. So is the horse a very high stress, anxious horse? Is the horse a cribber? Some of those things can play a role in trying to figure out why the horse is healthy as well. Again, they might be comfortable just consulting on treatments, or they might recommend evaluation, but really it's up to you to reach out to give them that information so that they can help advise one way or the other. I'm going to make a note. Here's one of my pictures. Sorry. I'm going to make a note on Banamine. Okay. Probably everybody in this room has heard Banamine. It's a very easy kind of trigger word for horse people. Almost everybody's got it in their box or at home. So a note about it, the drug name is flunixin-meglumine, okay? This is an NSAID, so it's a non-steroidal anti-inflammatory drug. This drug does have side effects, particularly with the kidneys and particularly with the stomach. So a horse, again, I alluded earlier to the fact that kidney disease horses can present with signs of colic. If you give a very dehydrated horse or if you give a horse that has already had a whole bunch of other drugs that have these same side effects, or if you give a horse that has any sort of kidney disease that you might not know, this drug, kind of willy-nilly, if you will, it can have some serious side effects for the horse, and it can absolutely play a role in the long-term prognosis of the horse. The other thing I want to note about Banamine is that the injectable formula, if you ever have the injectable formula in front of you, that formula is never to go IM or intramuscularly, okay? The reason being is that it causes a bacterial overgrowth that leads to something called clostridiomyositis, which is what this horse in this picture has. So he got injection intramuscularly and did not survive this situation. This is very, very commonly fatal for horses. If clostridiomyositis gets overgrown. So just be very wary of that. It can happen with anything that is injected into the muscle, but Banamine is one of the drugs that is most commonly linked to this happening, okay? So again, Banamine, lots of people have it, lots of people use it very frequently. It is a very good drug, but it really should be used under the direction of a veterinarian, okay? So what do you do kind of based on the situation? The horse has very mild signs, it responds to minimal treatment, you've consulted with a vet, follow their recommendations. Again, Banamine might be given under veterinary guidance, and sometimes that's all it takes is kind of one dose of Banamine, kind of help them through whatever crampiness or spasmodic colic they're working through, and then they do well. Typically speaking, again, following recommendations from your specific vet, but typically speaking, we'll hold food for a little bit. And that's to make sure that the horse is passing the GI tract, has a little bit of rest. Certainly no grain when we reintroduce them back onto feed. We're reintroducing them back onto hay only, and we wait a few days for grain to give them, again, a chance to rest. Confining them to make sure that they're passing manure. Certainly hand walking every couple hours as able is very good. Even if the horse isn't showing overt colic signs, that can kind of help continue to get them to pass additional manure or work through any sort of crampiness that they're experiencing. And then we absolutely want to encourage water consumption. So you always want to have a plain bucket of water available for the horse, but you can hang a second bucket that's got any sort of additives. So some people put electrolyte powder, some people will put a very small amount of Gatorade. Gatorade is very salty, so you can't just give a whole bunch of it, but some horses respond well to that. Some people will just put a handful of sweet feed into the bucket, and that sweet feed will release a little bit of molasses, and that can encourage them to drink water as well. And again, kind of gradually refeeding with soft hay, very small quantities of like a senior grain mash that is mostly made up of hay, something like that, to get them back onto feed. If your horse is showing very severe signs or is being very unresponsive to treatment, certainly a veterinarian needs to get involved. So when we're looking at horses in the field, we certainly do have some additional kind of constraints with what we can do in the field. And so certainly your vet's going to do a physical exam. They may administer medications, so sedatives, which also have some analgesic properties as well. Buscopan is a smooth muscle relaxant that we'll very frequently use if we suspect a spasmodic colic, but it also helps facilitate when we do our palpation per rectum exams. Certainly that's one of the things that's very commonly done in the field as well. So palpating their abdomen per rectum, we can check them for displacements, obvious impactions, gas distension, those sorts of things. And then nasogastric intubation, so determining if they've got excess fluid in their stomach and whether or not we need to get that off. If the stomach's empty, there's not a whole bunch of excess fluid in there, certainly that nasogastric tube can also be utilized to give them a large amount of water with either laxatives, electrolytes, those sorts of things. And then depending on the veterinarian and what equipment they have available to them, certainly we can do some what's called stall side blood works. We have some blood meters that we can run just right at the truck that give us a little bit of information. And then some people will be able to utilize ultrasound in the field as well. And that certainly can give us a bit more information, but sometimes people don't have these things available in the field, and that's where referral into a hospital can be of benefit, particularly if there's any sort of question on what direction the horse might go. So if and when a horse is referred to a veterinary hospital for additional workup, these are some of the things that we're gonna do. In the order of the diagnostics that we do kind of depends on the case and how they look walking in the door. So in regards to blood work, we've got a few different things that we can do. PCV total solids is going to help us with our level of dehydration and what the horse is looking like from a protein standpoint in their blood. So PCV is, the term is packed cell volume. And that's the percentage of red blood cells, and it's used to measure either the level of hydration or the level of anemia throughout the bloodstream. And then total solids is the amount of protein that they have in their bloodstream, and this can go high with dehydration, or if they have protein loss, such as like an inflammatory issue, we can actually see that number go low, and that's very important to know as well. We can run something called a blood gas. This is going to give us all of our electrolytes, which can certainly be very abnormal in some causes of colic. And then one of the really important ones that we're always interested in knowing is lactate. And I'll go into this a little bit more too when we talk about the surgical colics, but mildly elevated lactate can increase with dehydration. But really higher levels are more closely associated with significant loss of oxygen to the tissue. So lactate or lactic acid is made when the cell doesn't have enough oxygen for anaerobic glycolysis. So we're going into a whole bunch of biology stuff and the Krebs cycle and all these underlying metabolic things, but essentially what it means is that an elevation in lactate means either there's a loss of blood flow somewhere, there's lots of loss of oxygen to the tissues, or a combination of the two. And so when we see mild cases with dehydration, it's because when the horse is dehydrated, all the blood that's in their muscles and the capillaries within their muscles will preferentially shunt all of it to the abdominal organs. So the muscles will start making lactic acid for energy so that the internal organs get the blood supply that they need. But higher than that usually indicates a different loss of oxygen. Complete blood count is, we're particularly interested in their white cells. So certain causes of colic will cause shifts in their white cell counts that can indicate an infection within the GI tract, or something more serious that's going on from an inflammatory standpoint. And then a chemistry panel we're going to run to look at kidney, liver, and muscle enzyme values. And those things, again, because we've got all those organs in the abdominal cavity, we want to look and make sure, are they functioning appropriately or not. The abdominal ultrasound, we're looking at a few things in particular. So we're going to look for the stomach, the spleen, and the left kidney. We should be able to see those right next to each other on the ultrasound. And if we don't, that could indicate that part of the colon has displaced and moved in between those two organs. So we look for that. We also look to see if we can see any small intestine, and we're going to look at the size of the small intestine, the motility, what contents, the wall thickness, and we're also going to try and identify whether or not there's something called two populations of small intestine. So that's where we see some loops of small intestine that might be thick and small and not moving, and then we see some loops of small intestine right next door that are very large and they're trying to move and they're really fluid filled. And that's a pretty big red flag for us in regards to, is there something going on where there's a strangulating lesion or something like that, lesion within the small intestine that's cutting off the blood supply to part of it, okay? So large intestine, we're looking for some of the same things, wall thickness, whether or not we can see certain vessels that might indicate it's displaced. The cecum is another part of the horses. That's the hindgut fermentation vat in the horse. It's the equivalent of our appendix, but our appendix is not quite useful. Their cecum is very useful. So we're going to look at that cecum and whether or not that's enlarged and what the contents are. And then we're going to look in the ventral abdomen. Sometimes we can see sand on ultrasound if there's enough of it. We're also going to look and see, is there a whole bunch of free fluid in the abdomen that might indicate that something is wrong and we need to sample that. So I've included just a few images here, and I know a lot of it's just kind of black and white, but we do take a lot of time practicing, knowing what we're looking at with these images. So I've kind of pointed out some things that hopefully make sense here. Big black areas and anechoic, what we call areas. on the left there, that indicates an increase in free abdominal fluid. There's always going to be fluid within the abdomen that's bathing the GI tract, allowing the GI tract to move around freely and lubricated. If we see a lot of that fluid, it's abnormal. And then this is kind of the two populations of small intestine I noted. So you've got one that's kind of round and anechoic, and then the one on the bottom, you can see the wall of those circles is much thicker. And then this is a colon that's got a very thick wall. So again, we can kind of tell when the mucosa of that colon is really thick, and this would be an indication that there's a lot of inflammation within the colon. So these are the sorts of things that we're looking for in the abdomen. When we palpate on per rectum, remember we can only feel a certain amount of the abdomen, so there's lots of stuff we can miss on a rectal, but what we're assessing for really is, are they obvious displacements, impactions, or gas distension? Certainly when we do this procedure, safety is of utmost importance, so most horses are going to get sedated. They're going to get Buscopan, which is the smooth muscle relaxant, lots of lubrication. There is always a risk of damage to rectal tissue when this procedure is performed, but it can give us a lot of good information. So it's something we very commonly do, but just be aware that it's not without its potential complications. And then here's some kind of fun pictures of what we're patting at. So you kind of have to use your imagination a little bit when you're doing this, but what we're feeling for is the spleen and the kidney, like in the upper left photo. We're touching the cecum, like the bottom or the middle photo, excuse me. And then the far right photo, we're kind of sweeping along the ventral abdomen and seeing if we can identify the colon and the pelvic flexure, which is the most common spot in the horse where impactions occur. One of the next things we're going to do is nasogastric intubation. So horses, if you don't already know, this is fairly common knowledge, but horses can't vomit, okay? The pressure within the sphincter that goes between their esophagus and their stomach has a really, really, really high pressure point. And so it doesn't just open two ways, and they don't have the same musculature or ability to press with their abdomen to get that content to come back up. So a horse's stomach will usually rupture before they vomit it back up. And so that's a problem. That's fatal when that happens, unfortunately. And so this can be a really important thing to do to make sure that that stomach's not too full of liquid. So the tube is passed in the nose into the stomach, and then reflux is what we term abnormal amount of fluid within the stomach. And where we can see that happen is all of the fluid that's getting produced downstream. If there's a reason why there's that downstream, the small intestine, something is getting cut off, they'll actually have that fluid build up and back up into the stomach, and then it's got nowhere else to go. So that's why it's important to assess for this. And again, if the stomach is empty, we certainly can then administer oral fluids, particularly if the horse hasn't been drinking very well or if it has an impaction, so we can give laxatives and electrolytes. Just a note about mineral oil. Lots of people have heard about mineral oil. It is better for prevention of impactions than it is for treatment. So it actually does not penetrate impactions like fluid and electrolytes does. And mineral oil is fatal if for some reason it ends up in the airway as part of this process. So it's totally just depends on the veterinarian and what they're comfortable using. It's certainly not wrong to use, but you'll see lots of veterinarians that don't use it. And it's because there's just multiple things that we can give that all have the same sort of underlying treatment basis to them. One additional thing that we do fairly frequently is called an abdominocentesis. So this is where a sterile cannula is inserted into the abdomen, and we collect a sample, and we're going to assess it for what it looks like from a clarity standpoint. We can look at the cells that are in there, the protein, but then also that lactate again. So if there's something in the abdomen that is losing its blood supply and its oxygen, that lactate will typically be higher in the abdomen than it is in the bloodstream. And so we want those two numbers to compare to each other to decide, does it look like there's something going on in the abdomen that we have to fix with surgery or not? So how do we determine what's medical and what's surgical? As tough as it is to say, sometimes it's just their level of pain. Medical colic, typically their level of pain is going to be manageable or mild. They respond to treatment well. These are things like impactions, simple impactions, gas or spasmodic colics, mild displacements. Certainly there's other underlying causes, specifically something called colitis, which is a bacterial infection or a viral infection that causes inflammation within the colon. And those sources are not typically surgical, but that can be a pretty severe medical cause of colic, but it is medical, okay? And then from a surgical standpoint, how do we decide a horse needs surgery? So if they've got unrelenting or severe pain, nothing we do is helping, they're unresponsive to treatment. The abdominal fluid is what we call serosanguine, so it's got a red tinge to it. It means that there's enough damage to the intestine that the little blood cells are leaking out of the GI tract and it turns it red, okay? Lactate I brought up again, so the belly lactate is higher than the blood lactate, gives us a really good indication that there's something going on in there that's really serious. If they've got really severe distension or displacement that we know is not going to be able to fix itself on its own. And then again, if we see kind of two populations of the small intestine or some other red flag on that ultrasound, that certainly can make the decision for surgery being required fairly quickly. So in regards to surgical management, how are we going to treat it? A lot of times enteral fluids, so oral fluids via that nasogastric tube is the most efficient. We also can put in an IV catheter and give them IV fluids to help them along and supplement them with electrolytes that will help their GI motility. If we've got an IV catheter, we can also administer additional analgesics, such as lidocaine is one of them that we'll use fairly frequently, that doesn't have the same side effects as Vanadine does. So particularly in a really dehydrated horse, there's other things that we can give them. The procedure that you're seeing in the video is called trocherization. So if we've got a horse that we either think we can help a displacement, they're just really, really gas distended, we'll release the gas with a catheter via their side. Sometimes this is just to buy us enough time to get to surgery. Sometimes we do this if surgery is not an option. We're kind of just trying different things to see what we can help fix. But this is something that we can do fairly routinely. Repeating diagnostics, and then certainly sometimes in all of this, we might recommend doing other procedures, such as doing a gastroscopy to check if the horse has gastric ulcers, because that can be an underlying cause of kind of mild recurrent colic as well. At least, and I can really only speak to you know, what I know and what this area of the country knows. So I apologize to kind of everybody who's scattered. This might look a little bit different depending on where you're at and who you're around in the hospital, but at least for this area, a typical estimate that's given for medical management in hospital without IV fluids is kind of the $25,000 to $3,000 range. And then if we do put them on IV fluids, the IV fluids themselves are fairly expensive. They can help very, very much in a lot of cases, but it does increase the price of medical treatment a little bit too. And then surgical management, now we're going to start seeing some of those pictures, so look away if you'd like. Again, the intake evaluation is going to kind of depend on the patient's degree of pain, the instability, that sort of thing. Lots of cases are going to require some stabilization prior to surgery, so that's kind of part of what we have to do for them too. And then if we have to take a horse to surgery, it's something that is based around their large intestine. So a displacement or an impaction that they're really, really painful to. So we have to do something called a pelvic flexure enterotomy, where we dump out their colon in surgery and take out all the impaction. For the surgery and aftercare, typically we're going to tell people about $11,000 to $13,000 for a more simple surgery like that, okay? And then if we've got a small intestinal lesion or a complicated large intestinal lesion, so we have to take out a portion of bowel that has died off or lost its viability, it was out without oxygen for too long. Those cases require a longer procedure, much more supportive care, higher incidence of complications after surgery. And so they're typically a little bit more in the $13,000 to $15,000 range for colic surgery. And then very infrequently, I say it with hesitation, very infrequently, in select cases, we do sometimes do colic surgery standing. And so it's always preferred that we can lay the horse down under general anesthesia because we can see much more of the GI tract. But there are certain cases where we might be able to address something simple with the horse standing and making an incision in their side. And so that can be a little bit more cost effective. Still colic surgery, but is one of the things that we are able to do sometimes. So just because this comes up very, very frequently, here's another question for everybody. What's the most common cause of a strangulating small intestinal lesion in what we would consider a geriatric horse? So over the age of 20. They actually do have one specific thing that it's kind of this until proven otherwise. So it's called a pedunculated lipoma, pedunculated strangulating lipoma. And so this is a couple of pictures of various ones I've run into so far, but I've got a lot of these pictures, unfortunately. So what can happen? Yeah, very good. Impactions are also very common in older horses, but not for small intestinal. That's more a large intestinal issue. So what happens is horses naturally make these lipomas in their abdomen. If you think about like an older dog, lots of dogs get cutaneous lipomas. So they get kind of old man bumps or old lady bumps. Lots of those are lipomas. Horses unfortunately make them within their abdomen. And so what happens is they hang from stalks. They're built from stalks. And they're of no concern really when they're just hanging there and nothing's tangled up in them. But what can happen is the weight of that lipoma, as the intestines just kind of moving around as it normally would move around, it can get its way around, make a kind of a loop around the stalk of the lipoma. And then because there's fluid in the intestine, that intestine then gets heavy and it ties itself in a knot around the stalk of the lipoma, okay? And then as it gets heavier and more inflamed and heavier and more inflamed, it cuts off the blood supply. And so you can actually see in the picture to the right, the lipoma itself has also cut off its blood supply. So they can be pretty tricky and complicated and sometimes involve so much of the intestine that we can't actually take out what all is devitalized. So this is unfortunately a pretty big deal in our older horse population. So this is, I put this in here just to kind of give a general picture of some of the specific things. And you guys will get this presentation as a resource after the fact, so you can kind of come back and look through this in a little bit more detail. But this is why signalment is really necessary for us to know, because there are certain breeds, certain ages of horses, and certain kind of clinical signs or clinical implications that do have higher instances of certain types of colics over another, okay? So just briefly, potential post-op complications if your horse unfortunately does have to have colic surgery. Colic surgery is a big deal in horses. And so there are a handful of things that can kind of happen post-operatively. Reflux or ileus is one of them, where the horse, because they had to go under general anesthesia, their small intestine can slow down and they can actually produce that vomit that we talked about a little bit ago. And it might not have anything to do with an obstruction, just that the intestine's not moving the fluid through like it's supposed to. So that's one thing that we can see. Horses can colic post-operatively, and if they have a small intestinal lesion and surgery on their small intestine, they're more prone to doing that. Adhesions are something that unfortunately horses and large animals in general are really good at making something called fibrin, which is essentially just kind of a sticky goop that's secondary to the inflammation within the intestines. And in horses, sometimes what we can see is that this fibrin can kind of plump various parts and stick various parts of the GI tract to themselves. And so we do absolutely everything possible in surgery to mitigate that, but it does still happen in a certain population of horses. And unfortunately, we don't have the magic 8 ball to know which horses are going to do that and which horses aren't. Incisional infection is probably our most common potential complication. Most horses do okay with this, but it does increase kind of the care afterwards. And hernia formation is one of the things we can see secondary to inflammation or infection rather. So that's when a very small part of the body wall can actually dehiss, what we call dehiss, or kind of come apart, and it leaves them with a little bit of a pooch in their abdomen that we sometimes do have to come back and fix later. It is why it is very, very important that post-operatively the horse follows a really strict recommendation for turnout and for work, because we need to allow the body wall enough time to heal so that these things don't happen. And then certain types of colic after surgery, or even before, will cause something called endotoxemia. So that's where toxins from the bacteria that are normally within the GI tract get released into their bloodstream, and it can cause a whole bunch of other things, laminitis included. So people don't necessarily, people know laminitis, they know we're founders, the other name for that. They know founder, they know laminitis, they know colic, but they don't know that very frequently they will overlap. And so that's another consideration that we're always careful about. And then in regards to a prognosis, so our medical colics are generally going to have a good prognosis, okay? The exception would be horses that have those severe bacterial infections or viral infections where regardless of our medical treatment, they can have some pretty severe complications from that. I've thrown a few numbers in here just from various studies. I'm happy to provide resources kind of after the fact, but trocherization, so where we release that gas via their side, if we have to do that procedure, there is a smaller percentage of horses that are considered survival to discharge horses. And frequently it's because we're doing that procedure if they don't have a surgical option. So we're trying it, but unfortunately they don't respond to it like we want to, and we end up needing to consider not moving forward with any more treatment. So when we have to do that, it always is not the best. We don't love to have to do that because it means the horse requires that gas to get out of there. And then horses that have recurrent colic, so small mini colic episodes kind of over and over again. IBS, or inflammatory bowel disease, is a disease that we diagnose in horses. And it's one of the most common histologic diagnoses. So within the cells or within the layers of the abdomen, that inflammatory disease is one of the most common causes. So something we keep in mind for horses that kind of have issues over and over again. Certainly always, if your horse unfortunately needs surgery, early surgical intervention will always improve prognosis. So the faster we get them there and the faster that we get the issue fixed, the better the horse is going to do in the long run typically, okay? We have made tremendous improvement in prognosis following colic surgery. Even in the last 20 years or so, there's been a lot of research into this, a lot of changes in procedures, and we've gotten pretty good at it at this point. So overall, if the horse has a small intestinal lesion, they're going to have a poorer prognosis than if they've just got a simple displacement or something like that. I put this up, it's a lot of numbers again, just kind of trying to show for a whole bunch of different types of underlying disease processes that require surgery, the numbers in general are pretty good. So typically speaking, we've got, anywhere from a 75 to even up to 100% survival to discharge in a lot of these studies. There are some that do poorer than others. And those are the things that once we know that's what's going on, those are the sorts of discussions that we have with people to determine, what the next step would be. Just a couple of more specific kind of situations that people commonly ask about foals. The three most common causes in foals are something called enterocolitis, so it's bacterial population where they have diarrhea. Meconium-associated colic, where they get impaction with their meconium or their kind of first manure output. And then just general medical colics are kind of the three most common. Foals typically have a good long-term survival rate if they're discharged from the hospital. And then older horses, I want to point out that in not just this study, but in several studies, age has been shown to not be associated with post-op complications like reflux or non-survival. So age is not a disease, older horses can do just as well as younger horses going through colic surgery, but certainly that's something that just needs to be an individual case-by-case basis. And we already talked about they do have an increased incidence of strangulating disease with those lipomas. This picture here was a foal that had parasite burden, and the parasites caused telescoping of its intestines. This is called an intussusception, where one part of the small intestine worked its way into the other part of the small intestine, and it actually cuts off its blood supply that way. So one of the things that we're careful about, particularly in younger horses. Foreign body obstructions. If your horse eats something that it should not, I very frequently have to go get it. I've got some pictures at the very end of some of the things I've pulled out of horses so far, so it's coming up. So these typically have a little bit of a higher complication rate, unfortunately. And it's because a lot of times they sit for a long time, or the thing that they've eaten has caused inflammation or damage at lots of different spots within the GI tract, not just one, okay? Sand impactions typically have a pretty good survival rate, but we certainly treat plenty of horses surgically that have their only issue is that they've got sand in their colon. And so that's one of the management things we'll talk about. And then I mentioned or alluded to earlier, horses that crib are that stereotypy behavior is something to note. If your horse is a cribber, they are at much higher risk of developing something called an epiphytic foramen entrapment. So that's where their small intestine gets caught behind their liver, and it will cut off the blood supply to the small intestine. And those horses, just in general, surgery is much harder. They're much harder to fix, and they do much poorer. So only about 50% of them survive to discharge if you look at all of the surgeries. So that's one of the things that if that's a stereotypy your horse has, it really is good to consider different management things to be able to control that, because it does put them at high risk. Everybody always wants to know, can my horse go back to work? And yes is the answer. So horses that have gone through surgical colics, many of them will return to their expected performance by at least a year. Lots of foals will go to their intended athletic performance, and then thoroughbreds that race, some of them don't race at all if they've gone through colic surgery before they race. Some people choose not to race them at all, but of the ones that do race, they race just as many times and won just as much money as their siblings. So again, they can go on and do just fine. Another study looked at just simple displacements that went through colic surgery. They didn't have any detrimental effects on performance, so they can do pretty well. So how do we prevent it? We've gone through all this information. How do we keep them from doing this? Some of the things I've pointed out as we've gone. Establishing a routine, having a consistent schedule will reduce their stress. Feeding a high quality diet, avoiding excess grain or excess carbohydrates that get into their large colon. Dividing their daily rations for the same reason, avoiding colon overload of those grains. Pre-choice hay is always the best in over meal feeding, just in regards to the health of their GI tract. Having a regular parasite control program and regular dental exams is really important, particularly from an infection standpoint. Having daily exercise or turnouts and changing those things gradually, that all helps with GI motility when they're having that daily turnout. Fresh, clean water and encouraging them to drink with some of those things we talked about earlier. Avoiding feeding directly on sand and dirt. This is one of the easiest things. If you've got an area where you feed your horse that's really sandy, really dirty, putting mats down. So it can be something as simple as putting stall mats down in the area that they're eating to prevent them from consuming as much gravel or sand. Checking your hay, bedding, pasture, environment for any sort of indigestible materials. Hay netting is the most common thing, at least I have pulled out of horses. So if you're feeding like big round bales and you put them out with the hay netting or you don't very carefully check it, they get that hay netting. It is the perfect conduit for all of their feed material and everything else to pack together and form what's called a phytotrichobezoar. That's a really fun word to say, but it will form what's called a bezoar, or essentially a poop rock, okay, that won't make it all the way through their intestines. And then certainly toxic substances, noxious weeds can absolutely cause colic, and so checking to make sure that they're there. And then just reducing stress in general. We can go a whole nother lecture on equine ulcers, but that is one of the things that, you know, a stressed horse that's got a lot of anxiety and not a good routine is certainly at higher risk, just in general for ulcers and colic. Just a very quick note on insurance, just as kind of an FYI. There is horse insurance available. Many people do know that, but there's different types. But the thing I want to point out is that most insurance policies require communication prior to the horse going to surgery and prior to the horse being euthanized, and also if the horse gets hospitalized. And if we don't communicate with the insurance companies when any of those things happen, it is grounds for them to not be able to file your claim, okay? And so what we need to know from the veterinary standpoint is right away, we need to know if the horse is insured, and then having this information for us is really important, particularly in emergency situations. So have this stuff on hand if your horse is insured. It'll make things go much faster when you get that horse to surgery and get it treatment as fast as possible without delay. So kind of key takeaways here. The colic in general, right? Very complicated. Early intervention is definitely key. Consulting with your veterinarian, having a good established veterinary patient relationship is important. Helpful to know how to do a physical exam. If there's questions about that, you can talk to me afterwards or ask questions. But knowing that and practicing with somebody who's comfortable with it is really good to do, because that gives your vet a lot of information when you do call them, so that they know, you know, hey, I've got to prioritize this, or it sounds pretty mild, okay? Again, Banamine, use it appropriately, use it under the guidance of a vet. Every diagnostic that I've talked about is essentially, I like to explain it as a puzzle, right? We're attempting to put all the different pieces of the puzzle together in order to get the whole picture and give you, as the owner, the most information we possibly can in order to tell you what's going on, what the recommendation is going to be. So I know this all seems like a lot, and many people think, well, oh, do we have to do all of it? But really, all of it is what's going to give you the most information to be able to know, hey, you know, this is the direction we have to go with this horse, okay? So not one diagnostic tool is always absolutely going to show us, without a doubt, that this is what is wrong, okay? And then again, appropriate management can help prevent some things, but one of the things I do also want to note is that there are reasons that horses colic that you cannot prevent, okay? That's just the unfortunate simple fact of this process in horses. And so colic, yes, there are a lot of things we can do to help make sure that it doesn't happen, but there are some things that we do or some things that we just can't prevent, that it's going to happen regardless. And so never should there be guilt involved in this situation, just learning and or recognition that sometimes you can do the absolute 100% best for your horse, never a hair out of place type of situation, and they can still have something go wrong. And that is just because they are not very well set up from a GI standpoint to not have things go wrong, okay, unfortunately. So please keep that in mind. So with that, I'm very happy to answer questions. And before you ask, the big rock is what is called an aneurolith. Have you ever heard of a horse making a stone in the abdomen? That is an aneurolith. That is what they look like. Bottom left is plastic bagging that horse decided to eat, was caught up in the bag. Like if you've ever been like dumping shavings, like this is that sort of plastic like shavings bag. Hay netting in the upper left corner. The middle one is a horse's ovary. That's a granulosa cell tumor, and horse presented for colic, and that thing weighed 20 pounds and was about the size of a basketball. So that mare held on for as long as she possibly could. And then the little piece of wire on the right, I pulled out of a little yearling that just so happened to find it in his pasture, and it made its way through his small intestine, poked a hole in the small intestine, and made a giant wad of adhesions that we had to take that horse to surgery and take that all out. So they can do the darndest of things. Don't put it past them. They will eat stuff. I promise you. So please, any questions?
Are you going,
Go ahead.
are you going to do a subject matter in on ulcers as well?
Yeah, so the question was, if we will ever do a presentation on the subject of ulcers. And that is something that I can punt to Jens as our coordinator. If that is a subject that you guys are interested in the future, we absolutely kind of put it on the list and see about making it happen in the future. Absolutely. It's a good suggestion. That's why I didn't bring it up too much, because it is a rabbit hole of all rabbit holes, unfortunately. Did I give you guys too much information? I should have left some stuff. I should have been like sneaky about some stuff. Yeah.
Couple of different questions in the Zoom about using sand clear. Whether you think that's effective or useful or not.
Yeah, absolutely. So the question was, the use of sand clear and whether or not it is helpful. So sand clear is made of something called psyllium. It is the same active ingredient as Metamucil. If any of us older folks in the crowd are familiar with that product. So yes, I'm there, I promise. So yes, what psyllium does is psyllium, as a dry component, as a dry active ingredient, it can be pelleted or powdered. When administered into the GI tract, what it does is it breaks down and creates a gel-like structure. And that gel binds the sand that's in the GI tract, and because it forms kind of a gel wad, the GI tract is much more effective and then be able to move that sand out, instead of having the sand sit in the bottom of the GI tract and just essentially get caught in the crevices and never be able to actually get passed out of the colon. So if your horse is at risk for, or their environment is a bit more sandy, certainly the use of products that have psyllium in it, such as Sand Clear is just one product, absolutely can be effective when given from a preventative standpoint, in helping clear out small amounts of sand from the GI tract. If the horse gets to the point where there's so much sand in the GI tract, typically speaking, those preventative things like Sand Clear are not going to cut it. We actually have to tube them if they don't go to surgery to get all the sand cleared out. We actually very frequently will tube them with Metamucil, like once a day, with large amounts of Metamucil once a day, for a number of days, and we can actually track whether or not the sand is clearing for their abdomen by taking serial radiographs. And so we can see that sand, the rock, shows up on radiographs, and so we can actually monitor that. So best to prevent, and yes, those products certainly can be effective, and they're certainly not harmful if the horse doesn't handle sand. So if there's any question, you absolutely can feed it. It's not going to hurt anything, and certainly can help. Anything else?
I just had a suggestion on the prevention of colic. I've known at least one horse to die from people meaning well, dumping a bunch of grass clippings over the fence, and Scout's no longer with us because someone thought they would be nice to the pony. So that, you know, and at the barn, my mare colic because kids came in the barn, I wasn't there, they fed her a bucket of apples.
Yeah.
And she got a gas colic and it was horrible.
Yeah.
And it cost me a lot of money.
Yeah.
So that's another, you put up signs or educate everyone that comes to your farm or barn, don't feed the horses, it's not your dog.
Yeah, absolutely. So, so the point that was brought up, I'm just gonna reiterate it for everybody else. The point that was brought up is that, well-meaning people that might think that, you know, giving them snacks or treats is being nice to them, but they don't understand the complexities of their GI tract. Feeding them large amounts of grass clippings or feeding them large amounts of apples or corn, those sorts of things absolutely is a very common reason why horses can colic, and it is because of the overload of the carbohydrates in their GI tract, causing development of a massive inflammatory response that then causes distension, it causes development of diarrhea, it causes the translocation of bacteria that I mentioned earlier. It causes a really, really large cascade of events. And so that absolutely kind of falls in with the don't let your horse eat things that it shouldn't. Those are absolutely things that fall into that category. So grass clippings are not safe because as soon as the grass is clipped, it releases all of its stress essentially, and it ferments, it starts fermenting. And when the horse eats fermented grass, that fermentation gets to their colon, and the bacteria and the protozoa that are in that colon use that fermentation and make more. And so essentially it creates alcohol sugars in their GI tract. And when alcohol sugars get into their colon, it's a vicious cycle. They just make more and more and more of it. So yes, absolutely. Thank you for bringing that up. And I wish I had time to go through like every single little thing that can happen. And I don't, but that's a very good example of one thing that absolutely can cause some severe issues. So.
A few questions in the wheel, related to walking your horse. How much do you overdo it? Steps for that.
Yeah. So again, the question is, walking your horse, and can you overdo it at any point in time? And so, yes, the point of walking your horse, walking them or exercise, certainly can help to dispel gas from the GI tract. It can help with cramping, abdominal cramping or cramping within the GI tract. It can help prevent them from, as long as they're walking and moving, they're not trying to roll and hurt themselves by rolling. And so it certainly can be beneficial. It does not need to be constant. If you're walking the horse and you walk them for 10-15 minutes or so and you stop and they're quiet, you can give them a break and let them get some water and those sorts of things. And do it again in another few hours, as frequently as you're able to. And as you start seeing manure pass, those are all things that make everybody happy. If you're walking your horse and if you stop walking the horse immediately is trying to go down and roll, or they're trying to do that as you're walking, those signs are severe enough that a veterinarian absolutely should be involved. So, the overdoing it comes into play where if you're walking, they're quiet and you think, oh, this is all fine. And as soon as you stop, they're going back to their colic signs. That's not a horse that should be like, okay, well, we'll just keep walking. Okay. And then the other one other thing that I didn't really touch on in this presentation, but just to kind of mention, horses that have a muscle disease or myopathy that cause them to tie up. So this might be something that HYPP or PSSM or exertional rhabdomyolysis. This is again kind of another topic for a different day, but those horses can often look colicky because they become painful. Their heart rate goes up, their respiratory rate goes up, they become very sweaty, but they don't want to move. And in those horses, forcing them to walk does more muscle damage than leaving them be. And so it is kind of important to distinguish if the horse is tying up and knowing that the horse is tying up versus colic, because if they're tying up, again, it can look kind of similar, but their body will become very rigid, their muscles become very hard to palpation, and if you force those horses to walk, you're doing more damage to the muscle, which is not a good thing. So that's kind of the one particular situation that we really want to differentiate. Is this colic, or is it something going on with the musculature?
We're going to go ahead and end that here for in person, and we'll gather more questions online for folks on Zoom, and you can answer those later. So let's give a round of applause to Dr. Jurek.